And here I think there's several things to consider. Um, One was certainly the general health of the population. 1918 was very different in terms of the general health of individuals. Clearly, I made a point about how health was improving because of medical and sanitary public works innovations that had put an end to a lot of previous disease epidemics. But at the same time, life expectancy was low. Really 20 years lower than what our life expectancy is today in the United States. The air was dirtier. Most things were powered by coal, so people were breathing in. Hence all of the respiratory diseases that we see. Dirty air. And there was a lot that medical science didn't understand. For one thing, doctors did not know that it was a virus that was causing influenza. They had different theories that it was a bacteria actually that was causing it. Flu viruses were not discovered until the 1930s. And so when you don't even know what you're combating, it's hard to have effective measures. There were no vaccines, there were no ventilators, there were no antiviral medicines. So there was a lot that they didn't have that we do. But they did understand tuberculosis. And so what we see is that another deadly respiratory illness of the time. And what we see is a lot of measures being put in place that mimicked the way that public health officials had been combating and were combating tuberculosis. So I love this image. Speaking of kind of pointless things to do, but here's some soldiers gargling and another image of a soldier having his throat sprayed with a disinfectant. This did nothing, but they did it. And we can see in this sort of public health announcement of measures to take to prevent the spread of influenza, the ways that it indeed being informed by measures that we're currently in practice to fight tuberculosis here. Some of it's about just hygiene, but with tuberculosis, people understood the importance of, being with fresh air, ventilation, not coughing on each other, not spitting. Not spitting was a big thing. Apparently, Americans like to spit in this era because I don't remember a lot of no spitting signs for us in the last 2 years, but no spitting is a big thing in 1918 and 1919. And here, I love this one: avoid worry, fear, and fatigue. Stress was something they were aware of as well. Don't go to work if you're sick, and wear a mask. Now, a lot of the mask wearing was, in this case, just for sick rooms, but mask wearing was something that they were trying to socialize, just like we've been trying to socialize in our times here. So here you go. Here's all the no spitting signs that we see. I just love this. Stop spitting, everybody. I just feel like that's just really something else. Don't be careless. Good cough etiquette. Think about carrying a handkerchief. All of these things that people are being encouraged to do there. Keep your room open. And of course, the problem of masks were similar to the problem we had early on, which is that masks were just something that health professionals had access to in normal times. And so how do we get people to be wearing masks that they don't possess? And so here's an instruction sheet: how to make a mask for the prevention of influenza. I'm immediately skeptical of this mask because I can see through it, but it reminds me as well of some YouTube videos that I watched really early on in the pandemic when we finally got told, it's not just about washing our hands, but it's airborne and we need to put a mask on. And before masks were widely available, you were getting instructions in the New York Times, on YouTube, how to make a mask out of a bandana or something like that. So we're replicating, in a sense, a lot of the experiences that people had here. And then to make it to normalize to a certain extent wearing masks on the job. You need to have a mask to come onto the streetcar. You should be wearing masks at work. I mean, these again are things that seem normal to us now, but just like then, they're trying to. These are stage photographs to popularize this idea among the American people there. Um, Life moves outside, barbershops, a courtroom, doing its proceedings outside. The idea that fresh air is a great way to prevent the spread of the disease. And I love this. Everybody can figure out a way in America to monetize any event. And here you go. Since you have to spend all that time outside and you're being discouraged from sitting around with your friends, listening to a Victrola in your living room, go buy a bicycle, get healthy, get some fresh air, and do your bit for stopping the spread of influenza there. Now, this is what's happening on the home front. What about the war? I had mentioned that one of the common explanations for the origin point of the influenza virus pandemic is military camps. And clearly, the fact that this war pandemic coincides with the World War also leads us to ask questions about how the two are connected. And there's no doubt that, I mean, just look at that ship and look at even the hospital and think of the military barracks or the trains that soldiers are being packed into. And you can just, if you're leery at the moment of being in large crowds of people because of your concerns about how coronavirus might be spreading, imagine what's happening in these particular situations. And there are terrible accounts of ships arriving in France with 200-300 people dead because influenza has just spread throughout the ship as they are on the ship for 3 weeks to get across to Europe. And so the war put people and goods in motion to a dramatic extent. And the war was not paused because of the pandemic. So there's definitely a way in which the requirements of fighting the war really hastened the spread and the worldwide spread of this virus. And just to give you an example of choices that were made, in September of 1918, this is a scene from Philadelphia, Pennsylvania. The flu was detected in Philadelphia, but rather than locking the city down, the city council decided to go ahead with a planned Liberty Loan parade. And then they would, in their minds, okay, and then we'll institute these measures afterwards. So on September 28th, they have a Liberty Loan parade. Liberty bonds are the things you buy to help finance the war effort. And thousands of spectators show up, and this turns into a super spreader event. And so, a week after this event, influenza rates spike in the city, and really seen as a mistake in retrospect for sure, but the ways in which the war and the demands of the war were competing with public health officials' recommendations of how we should be, isolating and creating social distancing in order to stop the spread of the coronavirus, of the influenza virus. Sorry about that.